Welcome to the Medical Staff Voice Live. I'm Dr. Stan Froshoy, Chief Medical Officer at Community Memorial Health System, and I'm joined today by Dr. Christina Desai, hospitalist at CMHS. Welcome, Dr. Desai.
Thanks for having me.
It's great to have you here. This is a great opportunity for our medical staff and community to learn about you and your practice. It also gives us an opportunity to be enlightened with some of the specifics of your specialty and gives us insight into what exactly it is that you do. Tell me, first of all, a little bit about yourself, your background, training, what brought you to Ventura?
So I am a little bit of a local girl. I grew up in Agoura Hills, just 45 minutes down. I went to UCLA for my undergraduate, and then I went to Albert Einstein College of Medicine in New York for my medical school and did my internal medicine residency out there. I dragged my husband, who does gastroenterology, back out to California, and I have been practicing at Community Memorial for about 10 years now.
Oh my goodness. So really you are local. Agoura is part of Ventura County and really is a part of our county. So a few items. Do you do any particular procedures, specific procedures? Do you have any subspecialty interest in hospitalist medicine? And finally, what ages do you treat?
Well, we only treat adults. Many of us are either internal medicine physicians or family practice physicians. We have both within our group. We do some bedside procedures, but honestly, our specialty is in communication. We take care of people when they are at their most vulnerable, when they are in the hospital and they're ill, and we take that very seriously. We kind of serve best as advocates for our patients, for their families. We take care of them, try to diagnose and treat their diseases, and also communicate with their primary care physicians and with their families and with them. So we really hold our position in great regard, and we feel like what we do is really special because our patients come to us when they're scared and nervous and sick, and we get in most part we get them better and get them home.
Well, I do know that our scores for patient satisfaction with our hospitalists are quite good. I know that one of the things that you do that you did not necessarily mention, but I think is a critical item, and that is you really do coordinate the care of the patient with the consultants and subspecialists. Isn't that right?
Yeah, it can be very overwhelming with modern medicine. I mean, modern medicine has come such a long way in the last 50, 60 years. There's so many specialties and so many doctors, and the things they can do are amazing. Part of what we do is just kind of talk to our specialists, talk to our consultants, talk to our patients, and make sure that they understand everything that's going on.
And I know we've introduced a tradition now whereby you make a point of sitting down at the bedside of the patient to make certain that they feel listened to.
Yeah, we, our wonderful quality department and some of our physicians kind of started that about 8 or 9 years ago, and we found it really impactful for patients and for the physician just to have them and us realize that we have all the time in the world to listen to them and see what's going on. Obviously, some patients we can't sit down, typically patients who are in contact isolation, but we do our very best to sit down and take the time to listen.
What a wonderful specialty and response that we have in addressing that need. Thank you so much. Well, let me understand, you practice predominantly where exactly?
We practice at Community Memorial Hospital. We did expand to Ojai, our small hospital in Ojai, and a few of us actually do practice at a couple of the skilled nursing facilities in Ojai as well as 2 in Ventura.
Wow, that adds to an incredibly improved continuity of care, doesn't it?
Yes.
Wow. And it also prevents unnecessary readmissions, I'll bet.
Yeah, and I think our patients really like that the same group of doctors kind of can follow them within the system, have access to their records, And I know our primary care physicians really appreciate that kind of feedback and the handoff.
Yeah, I don't think there are many other health systems that provide that kind of continuity and high quality care. So we've talked a lot about the things that you do professionally. So what kind of outside hobbies, what kind of outside interests? Do you skydive? What do you do?
I am a really busy mom of 3. I have 3 kids. I have an 11-year-old, a 10-year-old, and a 7-year-old, and they keep me pretty busy. I'm also a huge reader. We love reading. We love doing puzzles at home. So I'm really spend most of my time doing kind of family stuff.
I could see where that would monopolize your time considering how busy you are here. And I don't mind saying you happen to be our leadership right now in PIP, and so you have multiple leadership roles both here and at home.
I'm very lucky that people have looked to me for that, so I'm really grateful.
Thank you. Well, this is for me the most fun of our discussion because it gives us a little bit of insight into just basically your personality, and it really is a stream of consciousness type of ask and answer series.
And he has not prepared me for this at all. So.
Absolutely not, because we changed the questions around. So you can't even look at the old questions to see what I'm going to ask. First of all, I'm really interested in this in light of how busy you are. Would you consider yourself an early bird or a night owl?
Early bird. I wake up at about 5 to exercise typically.
Good for you. You exercise on top of everything. Very few people are able to finesse that. Number 2, French fries or onion rings?
Oh, goodness. Onion rings.
Okay, I like that. Who that is famous do you admire and why?
I think that I really admire, right now the only person that comes to me is Michelle Obama. And I most enjoy her grace under pressure. And I find her ability to listen just something that's very admirable and hard to learn.
And quite positive oriented, wasn't she?
Yeah.
If you had a choice between 2 superpowers, being invisible or flying, which would you choose?
Flying. I feel like most people say flying.
I think you're right. That's what I would say. What was your longest road trip?
When I first moved from New York to Omaha, Nebraska from residency, I drove with my mom. I had come from a night shift, and my poor mother, she drove with me when I was just bleary from not getting enough sleep. But that was our longest road trip together.
Well, obviously you were well nurtured by your mother, and that explains why you're probably such a good mother. Podcast or reading a book?
Both.
Both. Good for you.
Both.
Do you have a favorite in one and or the other?
I love The Daily from the New York Times. I love Throughline, which is another one through NPR, which goes through history, and my boys love history, so we listen to Throughline a ton.
Wow, I'm going to have to listen to those now. Thank you. Do you prefer to be a passenger or a driver?
Passenger. Then I can read.
What wisdom. Oh, great. Laundry or dirty dishes?
Laundry. Laundry.
Okay, so if you had not become a physician, did you have a backup plan?
I didn't have a backup plan that would make me a living. I think I would love to be a lifelong student, and that's actually why I like medicine, because you can always learn. You're always learning about your patients. But I would love to go to college for fun.
Okay, well that's almost what we did. College, medical school, residency,
yeah,
right?
It was a lot of years.
What is the most interesting thing about you that we would not learn from your resume alone?
I think
that
I'm double jointed in my left thumb.
I love that. That's got to be one of the best answers I've ever gotten. Thank you. Thank you for that. And I hope that secret doesn't put you at a disadvantage anywhere. I'm not sure for what. Thank you for tuning in to learn more about Dr. Christina Desai. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org. And be sure to like and subscribe for more from your community health system. Thank you, Dr. Desai.
Thank you.